Hi, I'm Dr. Angela Yakey.
And I'm Dr. Kathleen O'Neill Smith.
Welcome back to the FIRRIMup Doctors Good Medicine docuseries.
We are so glad you joined us.
We want to provide you with credible health resources, guide you in your treatment options, and fire you up to take control of your health.
All right, happy Thursday, everyone, and welcome back to our FIRRIMup Doctors webinar. We are so happy for those of you that continue to join us each week. We really appreciate all the support we always get from you all. As usual, our emails are firrimupdoctors@gmail.com, and our NFIM hotline is still open, which is nfimgmv@gmail.com. If you ever have any questions or concerns, you're always welcome to send us over a message or give us a call at our office. And now I would like to introduce your FIRRIMup doctors, Dr. Angela Yakey and Dr. Kathleen O'Neill Smith.
Thank you, Emily. Wow, 27th week now in this COVID pandemic, and this is going to mark when we pivot to more of a wellness discussion. We're going to be talking about COVID and physical activity in general. How are you doing, Dr. Kathleen?
I'm doing great. And it's amazing that we're still going, but I'm looking forward to the next phase. And you and I were just on a video Zoom conference, and it absolutely just sends us right in this direction. So I'm so excited to kind of share some of the initial things that we're looking at.
Yeah, it kind of just ties it all together. So now let's just look at some statistics. 27 weeks ago, and here's where we are now. I know within our community, I'm managing still 4 persons under investigation, meaning we think they have COVID pending tests, and 2 or 3 COVID patients. So it's still pretty active in Gainesville, Florida, North Central Florida. A lot of accidental exposures, primarily young adults. Next slide. In the United States, 9 tests. Wow. Almost 200,000 deaths. That's very sad. 5 million tests in Florida, 674,000 confirmed, 13,086 deaths. In our county, Alachua County, almost 7,000 confirmed, 44 deaths. And yeah, we're holding steady, somewhere between 30 and 40 COVID positive patients. We haven't lost anybody, and knock on wood, no one's been intubated. So very aggressive, integrative approach. Once we think you've been exposed, we're watching you actually every day, definitely when you have symptoms, and trying to get you through so that you don't go into that phase 3, which is the lung phase, which we've been talking about for quite a while. So things are okay here in Florida. How's it going in Massachusetts?
I would say that, all the students are back. They're doing a good job here. I mean, they're pretty strict. In one of the local colleges, I think like 11 kids were expelled with no refund of their tuition this year because they broke the rules and got together in a group. So Massachusetts takes things very seriously, and we're really holding our own. Most of our deaths were early in April, with some obviously coming back. It's definitely increasing here. And we talked about it last week in terms of it increasing over 100% in some of the different communities where there are a lot more people who have come into town, but holding steady. And I would say we'll just have to wait and see what happens after the Labor Day weekend, which we're getting into that phase, see how many people get sick, but doing okay.
Yeah, it looks like Florida has surpassed Massachusetts. Florida's bigger geography though. We're at 13,000 deaths, and y'all are at 9,245. It's not a competition.
It's not a competition. The reality is that we are extremely, in terms of our approach to COVID, it's extremely conservative. And whatever on politics, we have a Republican governor. I don't think it matters. I think the people that are really managing this are extremely strict, including all of the different there's so many colleges here, and I know there are tons in Florida as well, but they are very, very strict.
Well, I think that's actually a good thing. Get this thing under control. Here we are in Alachua County. Our county 21 hospitalized this week, and our case fatality rate holds at 6 out of 1,000. Next slide. And so for this week, we're going to talk about COVID-19 pandemic and physical activity. And then we're actually going to spin on physical activity in general and its effect on the musculoskeletal system and the soft tissue or the fascia. And like Dr. Kathleen was saying, we've spent 14 hours at a National Institutes of Health HEAL conference on video, learning about soft tissue, fascia, and pain. And I know this is like your favorite slide. Do you want to go ahead and review this for us, Dr. Kathleen?
Well, I think that what's important is that when people have pain, particularly in a muscle or in a joint or whatever, they forget that this pain involves multiple tissues. So if we just look on the right, it can involve the connective tissue, it can involve the muscle, it can involve the nerve and the blood vessel. So all of those may be involved, and that's a really important thing to think about whenever you have pain, but more importantly, when you're going to treat pain, right? When you're thinking about how am I going to treat this pain, you've got to think about all of those tissues. You can't just think about one pain. And when we look and we compare the normal situation and relationship between connective tissue, muscle, nerve, and blood vessel, and then we see what happens over time, whether we have chronic pain and then, and an exacerbation with some of the changes in the nerve and in the muscle that extend to the muscle, it's really, really important to understand that this is pain is heterogeneous. It's not just one thing. And we have to, what we learned in the conference, I think, is that there is a large group of people across the country and even the world that are really looking to understand pain more. And we're not there yet, but I think, meaning there's no biomarker for pain, but I don't know that there will be. Do you, Dr. Ike? I think it's really heterogeneous. And from an insurance perspective, of course, we want to make a diagnosis. It's a shoulder pain, it's a knee pain. But from the perspective of really doing an effective intervention that will be sustainable, we've got to be really understanding more about all of these tissues and their interaction, not just with here, the localized spot in the myofascial system, but also in the brain.
Yeah, I think we're far from a blood test or an imaging test that diagnose pain, which is why we still use a pain scale of 0 to 10. But we're now elucidating why pain happens, and it's very, very complex, especially conditions such as fibromyalgia or myofascial pain. But one area that Dr. Kathleen and I both agree upon, which is fascinating, is the fascial frontier. So here in yellow, they look like yellow bars of butter, but that's actually connective tissue. And if you want to be a little more technical, it's called the fascia. And so we are going to be spending a lot of fascia time because it has 80% of the peripheral nerve transmission comes from the fascia. So I'll just define it for you. It's that silvery white material that's primarily in the outsides of muscles, but it actually envelops everything, nerves, vascular, every cell, every tissue. So it's flexible and sturdy, and it's the substance that surrounds every muscle, coats every bone, covers every organ, and envelopes every nerve. It keeps everything separate yet interconnected. And so we refer to it as a fascial frontier. And Dr. Kathleen O'Neill Smith and I just wrote the chapter in this book called Fascia Function and Medical Applications. Our chapter was on hormones and how that affects that connective tissue or fascia. And I was privileged to co-edit the entire textbook, and it happens to be #1 on Amazon still in sports medicine. So super excited about that. But also because you and I, Dr. Kathleen, we love to talk about healing, getting to the root cause of pain, and looking at regenerative measures such as fasting and peptides and potentially medicinal signaling therapies. So super exciting to have attended that 14-hour workshop.
Super. So two things on this that I want to say is that when I think about the fascia and how it envelops every component of the body, the important thing about, I think of it as the air. It's like air in the body. It's like oxygen. It's like, it's everywhere. It's ubiquitous. It's so important. It's ubiquitous. And then the other thing that I think is important in tying this back to COVID-19 is that this is probably the fundamental system, the fascial system, that causes the pain in the muscles, that causes airway issues, that causes GI tract issues. I think it's all within the fascia where this inflammatory storm is happening, and the inability. And it's also a massive, not just for inflammation with respect to a virus, but it's also part of what causes autoimmune conditions. So, and the latent COVID conditions. So it's auto-inflammatory, and it's a cytokine storm within this fascia, and that's what will feed the organ tissue. And then there's an autoimmune component that some people are predisposed to. So I think that the health of our movement is so key for helping the fascia to be healthy. And that's why I love that we're talking about physical activity with COVID, and maintaining health and maintaining flow and keeping this yellow connective tissue that's coating and enveloping every organ, keeping it healthy to the best of our ability.
And you brought up a great point about flow, because there's a lot of what's called extracellular fluid or interstitial fluid in there that's contiguous with the plasma inside the vessels. And it's really important to keep that healthy. And so when we actually do blood draws and look for biomarkers in your labs for fire, inflammation, rust or oxidative stress or immune dysregulation, when we do all those labs, we're actually trying to see what's going on in the fluid as well in the fascia. And that's where I think the rubber meets the road. And so very, very good point about moving the fluid.
Have to move. And remember, the last thing about this in terms of moving the fluid is that we, in medicine, at least the kind of medicine, functional medicine, integrative medicine, regionology that Dr. Akey and I do, we know that the muscle is the currency, that your muscle, the amount of muscle you have, is the currency of being young. So if you want to stay young, you want to prevent loss of muscle mass, which is called sarcomuscle, loss of muscle, and you want to promote keeping your muscles strong and healthy. So that's really important as the currency for how we age, the muscle and the fascia.
That's a huge point, that muscle is a currency for wellness. And we know that statistically, as you get older, if you're 65 years old and you have low muscle mass and the muscle's been by fat, which happens if you're immobile or you don't exercise, you're not going to live as long, and your mortality is going to be higher, just simply because you don't have as much muscle. Not only from falls, it has to do with metabolism, and having muscle actually decreases your risk of dementia. Those are some topics we could approach on latter webinars. I think those would be fantastic topics.
Sleep quality, pain quality, everything is related to this. So it's really cool.
And then one final thing about the chronic pain that people are experiencing, the chronic muscle aches and pain from COVID sequelae, is that I believe there's still inflammation in that fascia, the all over body hurt, fatigue that we're seeing in some people. Okay, so physical activity is critical to heart health. If you're not sick now, make sure you're moving, not only to move the fascia, but make the muscle and decrease depression. Inactivity obviously increases the long-term risk of heart disease and sudden cardiac death. Now, if you get sick with COVID-19 infection, you don't want to exercise that much. You know, most people that I've managed with COVID, they can barely lift their heads at the beginning when they're sick. So listen to your body, and don't push your heart. With the COVID-19 infection, in fact, it infects the heart about 20% of the time, especially. So, and puts you at higher risk for clotting or acute myocardial infarction, heart failure, and arrhythmia.
So I think it's really important to understand that if you don't have COVID and you're afraid of getting COVID, that should not prevent you from going out and moving. You've got to get outside, and you've got to be moving a little bit every day. You can just avoid, being close to people. But if you're passing them pretty quickly and you have mask on, they have a mask on, you'll be okay. So if you have another comorbidity like high blood pressure, diabetes, or something like that, and you're having a hard time with activity, I think it's important to have a conversation with your doctor about how to begin activity. And certainly Dr. Akey can help you with that. I can certainly help you with that, like how to gradually begin an activity program. So I think movement is really, really important for health and well-being regardless of whether you have a comorbidity. With COVID, I agree with Dr. Akey. That's not the time to start an exercise program, nor do I think you would be able to if you had COVID. So, but if you are recovering from COVID and you do have, as I do have some patients who have some myocarditis, which is a muscle, the heart is a muscle, some heart inflammation, we do have to keep moving a little bit. It's not extensive. We're not talking about doing, a marathon or anything like that. We're just talking about some movement. So we can talk about that later.
Then a common question that I get is, Dr. Kathleen, I'm walking outside. Do I have to wear a mask?
Absolutely. I think it's better to wear a mask. But if you're walking alone in the woods and you don't think you're going to see anyone, take your mask off. Absolutely. Walking alone, take your mask off. It's person to person transmission. This is not going to be like randomly someone walked by there 25 minutes ago and you're going to get COVID. I think that if you're walking alone, there's no one around you, take your mask off. I keep it on my wrist and then I put it on, or you can keep it on your neck, however you want to do it. You can, people pull them down, but whatever it is, you can put your mask on when you see somebody, coming by to protect yourself and to protect them. But you don't need a mask if you're alone. I never wear a mask if I'm alone.
I agree. That's what I do. Next slide. So, the study came out in July from the CDC, a data set from July, the month of July, that there's been a lot of mood effects to the COVID-19 pandemic, specifically 4 out of 10 people with anxiety or depression. And then sadly, in the month of, actually it was June, the month of June, 1 in 10 people seriously considered suicide. Now it's already September, so hopefully that's better. We're adjusting to a new norm. But we just wanted to bring up with this slide that was published from the summer is that movement is critical in terms of chemical processes that decrease your risk for depression. Specifically on the right, the arrow up, exercise and movement does everything right. It's anti-inflammatory, so it's anti-fire. It's antioxidant, so it's anti-rust. Helps learning and memory, helps grow brain cells, gives you endorphins, helps your immune system in a positive way, and protects the brain. On the other hand, sedentary lifestyle does the exact opposite.
Imagine all those things that can benefit you by a little movement.
It's the best drug. Your body's making its own drugs in a good way. Next slide. So this slide actually just says that during infection, don't start exercise, which we already said. Mm-hmm. And please, going into it as part of fortifying your immune system, you want to exercise if you're healthy. But should you get sick, talk to one of us if you belong to our population, or your doctors if you don't. Next slide.
Yeah, I think lifestyle issues are at least 50%. So, how you move, how you eat, how you sleep, very, very important.
It's critical, actually, and it's strengthening your immune system. Mm-hmm. And actually mood, just feeling well. And then this study I wanted to bring up was just published like 3 weeks ago from Wuhan, China. These were 55 people who had survived COVID-19. And there's a marker in the blood when they were hospitalized, D-dimer level, which is a clotting. It marks for clots like pulmonary embolus. And it actually predicted whether or not they would have chronic, like subacute lung disease, meaning have trouble breathing 3 months out. So I wanted to give you guys a head up with that. Basically, they were saying that 7 out of 10 of these group of people, 70% actually had abnormal pulmonary function tests 3 months out. So be patient if you have had COVID and you're not quite normal yet. Give it time. I know I had a patient with anosmia who couldn't smell this week, and we had reviewed anosmia should go away 2 out of 3 times. So with the lung disease, we're going to have to wait and see, at least with this series of 55 patients. Like I said, 70% had chronic lung disease, and hopefully they'll get better.
Well, I think a key thing with this, from the perspective of what we do, what I'd be curious about with these patients, and you do this testing and I do this testing, where not only do we look at D-dimer levels, but it's not that difficult to measure just a clotting genomic. Are you predisposed to clotting? Because some people don't know that they are. right? So a clot can be a clot in the lung, it can be a clot in the heart, a heart attack, a clot in the brain, a stroke, a clot in the calf, could be a deep vein thrombosis. But the D dimer level is going to tell you that your blood is more coagulative, that your blood is a little bit more turbulent, a little bit more rough and more inflamed. So it's a very easy test to do. So for people who, have concerns about clotting, we definitely would easily measure a D dimer. And then I think, obviously, if someone has a positive D dimer, that would trigger me to look for two things. Is there a genetic predisposition to this based on factor 2, factor 5, whatever, those are medical terms. But then more importantly, to consider maybe even blood thinner.
Yes, or at least high dose fish oils, which
High dose fish, of course.
Which actually is good in terms of anti-inflammatory. It thins the blood as well.
Mm-hmm.
But in terms of healing from having experienced COVID, certainly if you have myofascial pain, which a lot of our patients do, or trouble breathing, always think the anti-inflammatories like natural, like curcumin, glutathione, we've had whole full seminar on, glutathione antioxidant and vitamin C. To heal the nerves, if you have myofascial nerve pain, remember we've talked about phosphatidylcholine, and certainly the importance of high dose omega-3. So those are ways that you could fortify, but also at higher doses used to try to heal faster.
And vitamin D directly related to pain. Directly related.
Yes, please don't forget vitamin D. There's like so many studies now, not only with pain, not only with bones, not only with decreasing cardiovascular disease, but with decreasing your risk of being, if you had COVID, decreasing your risk of being admitted to the intensive care unit for pulmonary disease. Actually, Dr. Fauci actually was quoted as saying, yeah, vitamin C and vitamin D. And that's a big step when Dr. Fauci is saying, think about vitamin C and D as a dog. Great points. So there was a question in the chat about, are we into fitness trackers? I like any biometrics I can get. I personally have an iWatch, which I really love because I close my rings, makes me feel happy. What about you, Dr. Kathleen? First of all, I got to tell you guys, Dr. Kathleen is not only an exercise physiologist, an MD doctor, she's actually an Olympian, an Olympic level. She was an Olympic coach and she's an Olympic level athlete. So she knows this better than anybody. So they want to know about fitness trackers, Dr. Kathleen.
People are so funny with that, but I think I like data. I'm a data girl. So I love to track. And then I think tracking is motivating for me. If I didn't do, I track my steps, I track my miles, I clock miles in my car. That's how data driven I am. And I want to know if it's accurate, if I do the same miles every day. So I'm a data girl. But I think if you are prone to that, and if you think it can be motivating, because I find it very motivating, to know that maybe I only did a half a mile on Tuesday because I was in a conference, but I'm going to make it up for the rest of the week. So I have a weekly goal. My weekly goal is, to do so many miles. And if I haven't done that by Friday, I know that's what I'm going to be doing that weekend. So you can have a goal, and your goal doesn't have to be anyone else's goal. It's your goal, but iPhones track everything. And I think the watches are expensive, but Fitbits are pretty cheap. You don't need anything, anything more dramatic, or just clock something in your car and clock a mile, or clock a half a mile and walk a half a mile or a mile. I'm a big fan because data is good. You need data.
And I'm all for, I turned 50, as you all know, this year. So Dr. Kathleen convinced me to start exercising more. So I hired a personal trainer and I feel great. And I don't think I'd push myself as much as Dominic pushes me. So I worked out really hard yesterday, but I feel really great. So think about investing in yourself too, because there's no way I'd push myself the way my trainer pushes me.
A friend. Be accountable. I think it's nice to have a friend. So you and I talk about what we do, and we also do our chats when we're walking or exercising. Certainly not when your trainer's making you work.
All right, so that's the message for today. So physical activity, muscle is currency. Make sure you're moving. Take care of your fascia. Remember, fire, rest, and immune dysregulation ages bodies. We're going to be coming up with a content calendar in the next week or so, pivoting to wellness. We'll still be coming back to COVID updates, especially with major breakthroughs. So for now, be safe, be well, and God bless you all. And thank you for coming. Thanks for coming, Dr. Kathleen.
Oh, so good to see you again. Thank you all. We'll talk about the conference later. Thank you, Emily. And thank you all for being here.
Bye.
As always, a wonderful thank you to our doctors for spending the day with us. And now for the few supplements that Dr. Akey had mentioned. These were also from previous webinars. So if you maybe forgot about them or you really like these supplements, they're going to be listed again with another 10% off code. So the phosphatidylcholine is really good for your mental focus and your nerve function. Again, FIRRIMUpDoctors.GetHealthy.store is our website. You can always go to FIRRIMUpDoctors.com and then go under the shop tab and find us from there. And this 10% off code is valid through October 1st. We also have the triad that Dr. Akey mentioned, the curcumin, the glutathione, and vitamin C. Very good for immune function. Very, very good. This is one of their favorites. So again, if you would like any of these three, the 10% off code can always be used. Good till October 1st as well. Forgot to mention the code for this one was FIRRIMup PTCH. And the code for the triad, any of these three, is FIRRIMup Ageless, AGELESS. And then finally, our last supplements are the omega oils. Omega is wonderful. If you are not a vegan, then you can go ahead and get the Pro Omega and use the code FIRRIMUP Omega. But if you are a vegan, we actually have it made from algae instead. And this is going to use the code FIRRIMUP Algae, ALGAE. Again, all of these codes will get you 10% off of any of the supplements we just showed, and they are all good until October 1st. If you ever need to go back, you can always go back and watch our webinars on Facebook, and you will be able to find all the codes through there, and you can always email us or call us for more information. And then the Fascia Function and Medical Applications textbook is available now. We actually have some exciting news that we have a few limited paperback copies that are going to be signed in the NFIM office in Gainesville. You can email nfimgmv@gmail.com for curbside pickup, and this will be ready as early as tomorrow. If you don't want to come pick it up, though, you can always buy it on our FIRRIMUp Doctors website and Amazon. If you buy through our website, though, you can go ahead and take a 20% off discount, which unfortunately Amazon does not let you use. But the discount code is SCI20, and this will be good through December 31st. So if you're still debating on getting the textbook, you still have until December to take that 20% off. And finally, we have a few copies of our Kick COVID-19 to the Curb still left in the office. If you would like a signed paperback version, you can get one in the office, or if you just like the ebook version, you can go ahead and get one off of Amazon Kindle, Google Play, or Barnes & Noble. For those of you that don't know, the paperback version is $29.99 and our ebook is $9.99 across all three websites. But if you go ahead and purchase one of our books, you can get a 20% off discount code for our vitamin C and our zinc. As long as you can show proof of purchase with any sort of receipt or a screenshot from an email or a website, then we will go ahead and honor that code for you. But for now, that is all we have for you. We will be back next week with some more updates, and I hope everyone has a wonderful weekend.
We're so glad you joined us today.
We hope we've given you the tools to take control of your health.
For more good medicine and information about any treatments, supplements, and resources discussed today, please visit us at www.FIRRIMUpDoctors.com. That's FIRRIMUpDoctors.com.
And wherever you're listening from, remember to like us on Facebook and subscribe to our YouTube and podcast channels so you don't miss out. The information provided is not a substitute for professional medical advice. This should not be used to diagnose, treat, or manage health problems without consultation. If you do experience any of the symptoms discussed today, please contact your nearest healthcare professional.